And I mentioned also that report because I believe it's the best that also shows that smoking is a real risk for families. So if you're in a family that has IPF, the only thing we know so far that may bring out or make it be manifested is smoking. Of course, that having a genetic risk doesn't protect you from the other exposures that we know too, asbestos, silicosis, all the other external exposures that you heard from Dr. Johnson this morning. But the single most provocative factor in families, so the odds ratio is something like 4 or close to 4 for smokers in families. So, of course, lung doctors don't want anyone to smoke, but especially if anyone in your family has IPF, the risk may be greater than otherwise. So the basic understanding about which genes might cause interstitial lung disease and IPF actually began with the neonatologists, with Larry Nogi at Hopkins and Jeff Witz at Cincinnati, in a report about surfactant protein C mutation and interstitial lung disease in 2001. And so this was a baby with lung disease, and they did bronchial washings and looked for the surfactant proteins that are in the, so surfactant is the chemical that lines, or the solution that lines the alveolus that I showed you earlier. There's 4 different proteins in there, A, B, C, and D, and they were looking for those. Those are important to help keep the alveolus open at the end of expiration, keep it from closing, and the proteins may have a variety of different benefits as well as innate immunity and other things. But in this baby, they noticed that that baby had no surfactant protein C, and then they checked for the gene for surfactant protein C and found that there was a mutation that prevented the baby from having the surfactant protein. So this is the surfactant protein missing, surfactant protein C in the baby. These are 2 normal patients on the right, and then a baby with pulmonary hypertension and another condition. So it was the recognition that there was no protein in the BAL then led them to test that gene, and at the bottom they found this gene, surfactant protein C, had a change, a defect that eliminated one of the protein coding regions in it. So then they checked the mother, who also had lung disease, and these are 2 of the lung diseases that were on Dr. Johnson's list this morning, NSIP and DIP, and those are more inflammatory relatives of IPF. So that was the information in the report that we then used to test a family that had true IPF in many family members, and it was our fellow Alan Thomas who reported that in the Blue Journal in 2002. So he looked for a surfactant protein mutation in a large Canadian family. So this is the lady who had contacted me in the early 2000s, and their family had been very cooperative and had had tragic IPF in their family since the first death was in 1955. There were 12 adults, half of whom had had lung biopsy, and most of the other half had had transplants, so the lung was available to be looked at and had UIP, and there were 3 children in the family. So this is the one condition that can also affect children. Of course, it was originally recognized in children. And here's the family tree of that family. This is the lady who contacted us. This is the 1-year-old who died in Toronto in 1955. And you can see the pattern within this family. So I think this was the first evidence that surfactant protein C mutations can cause true IPF, and led then to understanding about IPF, at least from this cause and perhaps from others. The lady in the far left at the bottom is blue because she has been chose to be tested whether she had risk for the disease, and unfortunately does have the genetic mutation but doesn't have any evidence of disease. So most of these were adults who presented in their 20s or 30s. There have been 3 children. These 2 are children, and then this was a child that developed IPF. So they have a different form of interstitial lung disease. So the forms in children may have different names, and semantics is a big problem. So cellular interstitial pneumonitis or cellular pneumonitis of infancy is what 2 of them were diagnosed with, but basically it's an interstitial lung disease of a similar type that's very inflammatory. So surfactant protein C mutation and interstitial lung disease pathogenesis is very instructive. because I told you earlier there are 40 cell types in the lung. The type 2 alveolar cell is the only cell in the entire body that makes this protein. So all the cells have exactly the same genes, but which proteins they make obviously is highly different of whether it's a skin cell or an alveolus cell, but because surfactant protein C is made in one cell type in the body, the type 2 alveolar cell, then that has to be the cell where this disease begins, at least from this cause. And I think, so the central pathogenesis in this disease process is a limitation of cell survival of those types, and that would then mean that proliferation and inflammation, as you've heard about, are a response to cell death of the type 2 epithelial cells. So our lab team went on to demonstrate that those cells are very abnormal in the lady who had the yarrow and has since had a lung transplant. On the left here is a type 2 alveolar cell in a normal person stained for surfactant protein C, or pro-surfactant C is the only protein that an antibody is available for. But you can see these clear areas are the lamellar bodies. That's their roles where the surfactant is extruded from the type 2 cells into the alveolus, and they look just like concentric circles. And they're usually 3 or 4, and they're clear, and the surfactant protein C is adjacent to them, as shown here. And you can see how different these cells in the young lady with IPF are, whereas the staining is completely through the cytoplasm, and you really can't identify true lamellar bodies. So her type 2 cells were extremely abnormal by identification of the location of the pro-surfactant protein C. And our scientists then took that defective gene and put it into mouse lung epithelial cells. And this slide shows that those cells die 3 times as fast in the right column as cells transfected with a normal surfactant protein C gene or cells that were not transfected. So we showed that the type 2 cells were abnormal in the patient, that if you take the same mutation and put it into cells, they die quicker. And so there's a huge body of evidence about mutations in surfactant protein C. This represents the schematic of the gene. Those are the exons of surfactant protein C and the locations for where different mutations have been identified. There are now scores of genes recognized that are the basis, mostly for childhood lung disease. Of the 260 families at Vanderbilt, 5 of those have this basis for their underlying lung disease. And it is very instructive, at least for that basis. So the differences for IPF in families related to surfactant protein C are that it can affect children, and then further support for the duration of disease. It comes from Cameron et al. In 2005. And although you can't read this very well, you can look up that reference if you like. For instance, this gentleman, symptoms began at age 10 years old and was transplanted at age 65. So 55 years of IPF before transplant. I bet Emery's not seen that once. Yeah, so, I mean, it's unheard of to have a patient have IPF that long. His brother, symptoms began at a year old and had a lung transplant and is 70 years old. This 35-year-old woman has had interstitial lung disease since age 7. And then her brother has had asthma since age 6, is what it says. So I don't know Dr. Cameron, but it shows that the duration of disease in individuals who have surfactant protein C can be decades, and that's true in the family that we had. So anytime I see a patient that's had IPF 10 years or more, especially if there's any family history, then I think the possibility of surfactant protein C comes on the list.